we will be reviewing 100 high-yield pharmacology questions to increase your USMLE score, especially for the USMLE Step 3 and USMLE Step 2 CK. So let's begin. What is the treatment of choice of acute bacterial rhinosinusitis? Oral antibiotics, more specifically amoxicillin and clavulanate. So it's very high yield that you remember that most cases of rhinosinusitis are viral. However, if you notice that the patient is experiencing symptoms greater than 10 days, or they initially improve and then they get worse, you need to suspect a bacterial cause. What is the treatment of choice of prolactinomas? Dopamine agonists such as bromocriptine. Recall that prolactinomas are non-cancerous pituitary tumors that overproduce the hormone prolactin. And we can treat prolactinomas with medications as mentioned here, or with surgical resection. So the most common cause of these prolactinomas are due to pituitary adenomas. Patients with prolactinomas can present with headaches, visual changes. Signs of hyperprolactinemia in women include amenorrhea, infertility, loss of libido, and galactorrhea. While in men, they can present with symptoms of loss of libido, impotence, and erectile dysfunction. So what these dopamine agonists do is that they suppress prolactin secretion. So remember that dopamine suppresses prolactin secretion. Surgical resection is reserved for patients who cannot tolerate or do not wish to take dopamine agonists, and patients who do not respond to medical treatment. What drug can be used to treat patients with prostate cancer? Flutamide. So recall that this drug is a testosterone receptor blocker or an anti-androgen. Prostate cancer is typically a testosterone-dependent cancer and can be treated with androgen deprivation. So that's why using drugs such as flutamide, which are a testosterone receptor blocker, can be helpful in these patients. However, it's very high yield to note that they can experience side effects such as gynecomastia. What is the treatment of choice of tersadienol? IV magnesium sulfate. Recall that this drug is a very, very high yield for OB-GYN. It's used to treat conditions such as preeclampsia and eclampsia. Another high yield fact that examiners like to test about this drug is its signs of toxicity, which include depressed deep tendon reflexes, drowsiness, cardiac arrest, and respiratory depression. What drugs can be used to treat pulmonary arterial hypertension? Sildenafil, bosentan, epoprostenol. Recall that sildenafil is a cGMP inhibitor, and it basically increases blood flow to the penis, and therefore another indication for sildenafil is erectile dysfunction. It's very high yield to remember that if you administer nitrates with sildenafil, this can cause an extremely high risk of life-threatening hypotension. However, for a drug such as bosentan, its mechanism of action is to competitively antagonize endothelin 1 receptors. This decreases pulmonary vascular resistance. It is used to treat patients with pulmonary hypertension. You also have prostacyclin pathway agonists, which are prostacyclin or PGI2 agonists with direct vasodilatory effects on the pulmonary and systemic arteriovascular beds. These drugs are very helpful in treating patients with pulmonary hypertension. So you have epoprostenol, iloprost, and treprostinil. It's important to note that they can cause adverse effects such as flushing, jaw pain, hypotension, and pulmonary edema. So basically, the drugs listed here are from 3 different drug classes or groups. We have the PDE5 or phosphodiesterase 5 inhibitors such as sildenafil. We also have the prostacyclin pathway agonists such as epoprostenol, and we also have the endothelin receptor antagonists such as bosentan. What is the pharmacological treatment of choice of hypertrophic cardiomyopathy? Beta blockers. However, if there are patients who are contraindicated to use beta blockers or refractory to beta blocker use, then you can use non-DHP calcium channel blockers such as verapamil. What is first-line treatment of acute pericarditis? Nsaids such as ibuprofen. So recall that pericarditis is most commonly viral in nature. It's most commonly caused by a viral pathogen. So to treat viral pericarditis, we use NSAIDs. However, if it's due to like a post-MI pericarditis, then you'd use aspirin. If it's a uremic pericarditis, dialysis. If it is a pericarditis due to a immunosuppressive condition such as SLE, then you can use steroids and immunosuppressants. But recall that it's very highly that you recall that acute pericarditis is most commonly viral in nature, and for those cases, we use NSAIDs. What medications can reduce mortality in patients with heart failure? We can recall these medications with a mnemonic BASH: beta blockers, ACE inhibitors, spironolactone, and hydralazine. Which cephalosporins have anaerobic coverage? Cefoxitin and cefotetin. Probably said that incorrectly, but just look at the words on the slide right here. Let's move on. What classes of medications should be held for 48 hours prior to cardiac stress testing? Beta blockers, calcium channel blockers, and nitrates. However, it's important to note that you can continue these medications in patients with known coronary artery disease undergoing stress testing to assess the efficacy of anti-anginal medication. What drugs are safe to use in mothers with hypertension? Hydralazine, methaldopa, labetalol, nifedipine. And we can recall these drugs by saying, hypertensive moms love nifedipine. What is the drug of choice for prophylaxis against leptospirosis? Doxycycline. So tetracyclines are very high yield to know. The mechanism of action is that it reversibly binds to the bacterial ribosomal 30S subunit. It's also important to note the adverse effects. What most examiners like to test is one, that it can cause a photosensitivity rash, and two, it can cause discoloration of teeth. Also, it's important to note that tetracyclines are teratogenic and contraindicated in pregnancy. What is the antidote for ethylene glycol or methanol ingestion? Fomepizole. Fomepizole inhibits alcohol dehydrogenase, which prevents the metabolism of these alcohols to their toxic metabolites. What antiretroviral is recommended for neonates born to HIV-positive mothers? AZT. What is the next step in management for a patient being treated with RIPE therapy for TB for the past month that develops mild elevations in AST and ALT? Continue with current treatments and monitor the LFTs. So it's very important to note that subclinical hepatotoxicity is common within the first few weeks of isoniazid therapy. It is typically self-limited and resolves without intervention. However, significant hepatotoxicity warrants switching treatment regimens. So that's why you also have to monitor the LFTs. Recall that RIPE stands for rifampin, isoniazid, pyrazinamide, and ethambutol. So this is a very high yield to note for the USMLE Step 2, CK, and the USMLE Step 3. You can even be tested on tuberculosis on your CCS cases, and you have to recall the RIPE therapy. So you can recall the side effects for RIPE by using the mnemonic RIPE on go. Rifampin causes orange secretions. Isoniazid, neuropathy, B6 deficiency, drug-induced lupus, hemolysis, and of course, hepatotoxicity is very high yield as well. Pyrazinamide can cause gout, ethambutol, optic neuritis. What is the antidote for beta blocker ingestion? Glucagon. What drug is used to treat a 5-year-old with a bull's-eye rash? Amoxicillin. A bull's-eye rash is pathognomonic for Lyme disease. The treatment of Lyme disease is extremely high yield. So typically, if the patient is greater than 8 years old, we would use doxycycline. However, if they are less than 8 years old, we would use amoxicillin. So in this 5-year-old patient, that's why we would choose amoxicillin. However, if the patient has neurologic Lyme disease or Lyme carditis, we would then use ceftriaxone. Very, very high yield that you remember this. What is the drug of choice for acute viral or idiopathic pericarditis? Nsaids and colchicine. So this is a very high yield question that I wanted to bring to your attention because, as previously mentioned, Nsaids are used for viral pericarditis. However, you also need to give colchicine because it lowers the rate of recurrent pericarditis. What drugs can be used to treat urge incontinence? So you can recall the names of these drugs by saying on the darn toilet. So knowing or identifying the different types of urinary incontinence and knowing how to diagnose them and their treatments is extremely high yield. So the most common type of urinary incontinence in men is urge incontinence, and it is typically caused by BPH. What happens in urge incontinence is that there is overstimulation of the detrusor muscle, and patients present with frequent urinary leakage that also occurs at night and can disrupt sleep. They have the urge to urinate and may be unable to reach the bathroom in time. You can diagnose this with urodynamic testing. Another common type of urinary incontinence is stress incontinence. And you typically see this in women, and it's typically due to a weakened pelvic floor muscles, especially in women who have had multiple vaginal deliveries. Another possible cause is increased urethral mobility. That's why to diagnose it, you can do the Q-tip test, and you also can see this in patients when they have increased intra-abdominal pressure. So basically, leakage of urine while coughing, sneezing, laughing, and with physical exertion. However, they do not typically experience any urine loss at night like they do in patients with urge incontinence. And when you do a physical exam with patients with stress incontinence, you might even see a cystocele. What class of drugs cause teeth discoloration? Tetracyclines. This is very high yield to remember. As previously mentioned, tetracyclines, more specifically doxycycline, are used to treat Lyme disease in patients greater than 8 years old. What is the prophylactic management for exposure to N. meningitidis? Ciprofloxacin, rifampin, ceftriaxone, azithromycin. So the ones in green are for patients who are pregnant, so it's safe to use in pregnant patients. Or for other patients, you can use the drugs in red. So recall that ciprofloxacin is a fluoroquinolone, and it typically inhibits DNA synthesis, and the adverse effects of this include tendon rupture and QT prolongation. Fluoroquinolones can be used to treat otitis externa, and it's also used to treat gram-negative broths that are commonly seen in the urinary and gastrointestinal tracts. As you continue to watch this video, you will see another high-yield facts about fluoroquinolones. And we also previously discussed rifampin, which is used in the RIPE therapy for TB. Do you remember the high-yield adverse side effects of rifampin? Well, recall that you can remember this with the mnemonic RIPE on go. So rifampin can cause orange secretions. Ceftriaxone is a third-generation cephalosporin, and its mechanism of action is to bind to penicillin-binding proteins, thus inhibiting bacterial cell wall synthesis. Some extremely high-yield adverse side effects of cephalosporins include hypersensitivity reactions, autoimmune hemolytic anemia. They can also cause a disulfiram-like reaction, and vitamin K deficiency. Azithromycin is a macrolide, and its mechanism of action is to impair bacterial protein synthesis by binding to the 50S ribosomal subunit. Macrolides can be used to treat atypical pneumonia due to organisms such as mycoplasma, chlamydia, and legionella. It can also treat STIs, more specifically chlamydia. And macrolides can be also used to treat bordetella pertussis. So if you see a clinical case where a patient is coughing and oftentimes until they vomit, then you want to think about bordetella. And to treat these patients, you use a macrolide, such as azithromycin. Other macrolides include clarithromycin and erythromycin. What is the first-line treatment of a honey-colored rash over a child's mouth? Mupirocin. So basically, this question is describing a condition which is called impetigo. So impetigo is most commonly caused by Staph aureus or group A strep, and it can be treated with topical antibiotics such as mupirocin. Which antiretrovirals cause vivid dreams? Efavirenz, which is a NNRTI. So NNRTIs can cause adverse effects such as a rash, liver toxicity, and also neurologic symptoms, and they are contraindicated in pregnancy. What are the drugs of choice for chorioamnionitis? Ampicillin and gentamicin. Recall that ampicillin impairs bacterial cell wall synthesis by binding to penicillin binding proteins. And some adverse effects include hypersensitivity reactions, rash, and pseudomembranous colitis. However, gentamicin is an aminoglycoside. Aminoglycosides irreversibly binds to 30S subunits of bacterial ribosomes. High-yield adverse effects of aminoglycosides includes ototoxicity and nephrotoxicity that is increased with the use of loop diuretics, and they are also teratogenic, which is increased with the use of cephalosporins. How can you prevent hemorrhagic cystitis caused by cyclophosphamide? Mesna and irrigation. What drugs can cause dilated cardiomyopathy? Trastuzumab and doxorubicin. These two drugs can cause dilated cardiomyopathy, but one way that examiners like to test you on this topic is for you to distinguish which one causes reversible or irreversible dilated cardiomyopathy. So trastuzumab causes reversible dilated cardiomyopathy, while doxorubicin is irreversible. So another important drug to note is dexrazoxane. This is a cardioprotective drug that is used to treat or prevent the side effects of the chemotherapy drugs doxorubicin or trastuzumab. Which drugs are best for a patient with a previous or current history of gastric ulcers? COX-2 inhibitors. What is the treatment of choice of tinea capitis? Oral griselfulvin or terbinafine. What drugs can be used to treat non-pregnant patients with Rocky Mountain spotted fever? Doxycycline. If you know which drug is used to treat Rocky Mountain spotted fever in pregnant women, leave the answer in the comment section below. How do you treat entamoeba histolytica infection? Metronidazole. Knowing the antifungals is extremely high yield for the USMLE Step 3 and USMLE Step 2 CK exams. So let's do a quick review of metronidazole. So metronidazole is used to treat protozoal infections such as Giardia, entamoeba, and Trichomonas. They can also be used to treat anaerobic bacteria such as Clostridium, Bacteroides, or Gardnerella vaginalis. Metronidazole can be also used as a part of triple therapy in patients who are allergic to penicillin, so it's effective against H. pylori as well. High yield adverse reaction for metronidazole is, of course, the disulfiram-like reaction. It can also cause this characteristic metallic taste in the mouth. So let's say that a patient is being treated for an infection with entamoeba and they consume alcohol and then they start experiencing severe flushing, hypotension, and tachycardia. Well, you want to suspect that this patient is experiencing a disulfiram-like reaction. Which drugs can cause gynecomastia? Digoxin, isoniazid, spironolactone, cimetidine, ketoconazole, and estrogen. You can remember these drugs with the mnemonic DISCO. The most commonly tested drugs are ketoconazole, which is an antifungal, and spironolactone, which is an anti-androgen drug. If a patient is on spironolactone and they start to experience or develop gynecomastia, then you can switch the patient from spironolactone to eplerenone. What drug can be used in a woman who is currently pregnant and has a previous history of preeclampsia? Aspirin. Is furosemide safe to use in a patient with a sulfa allergy? No. So if a patient needs to be placed on a diuretic but they have a sulfa allergy, it is best that you give ethacrynic acid. Which antihypertensive should patients be switched to if they experience a cough from a previous antihypertensive? ARBs. So recall that ACE inhibitors can cause cough and angioedema due to a bradykinin buildup. These patients should be switched to ARBs such as losartan. What drugs can cause drug-induced lupus? Sulfonamides, hydralazine, isoniazid, phenytoin, procainamide. You can remember these drugs with SHIP. Also, you need to look out for drugs such as quinidine and methyl-dopa. What is the most likely drug that would cause a red rash on the neck after being treated for an infection? Vancomycin. The mechanism of action of vancomycin is that it binds to D-allo-D-allo, which is a cell wall precursor, and prevents peptidoglycan formation. They are used in treating ampicillin-resistant enterococcus such as Clostridium difficile, and they can also be used to treat MRSA. Adverse effects of vancomycin can be recalled with the mnemonic rotten. R for Redmond syndrome, O for ototoxicity, T for thrombophlebitis, and N for nephrotoxicity. To prevent Redmond syndrome, you can pre-treat with antihistamines and slow the infusion rate of vancomycin. Basically, how vancomycin causes Redmond syndrome is that it directly causes degranulation of mast cells and histamine release. Redmond syndrome is characterized by a pruritic erythematous rash of the face, neck, and upper trunk within minutes to days of vancomycin exposure. Another highly adverse effect of vancomycin is stress syndrome, drug reaction with eosinophilia, and systemic symptoms. Which drug inhibits reabsorption of cholesterol in the GI tract? Ezetimibe. So lipid-lowering agents are very high yield for the USMLE. Of course, you have the HMG-CoA reductase inhibitors such as simvastatin and pravastatin. They reduce the cholesterol levels by preventing the synthesis of mevalonate, a cholesterol precursor, by inhibiting HMG-CoA reductase. They can cause hepatotoxicity and myopathy. Ezetimibe, however, inhibits the sterol transporter at the small intestine brush border, preventing the absorption of cholesterol. This decreases the hepatic stores of cholesterol. It's primarily used to decrease LDL and can also be used in combination with a statin, which I just told you about. However, when used in combination with statins, this can result in GI upset. Which lipid-lowering drug can cause flushing? Niacin. So niacin is vitamin B3. It inhibits hormone-sensitive lipase and also inhibits hepatic VLDL synthesis. Niacin toxicity can cause red and flushed face and upper body, and it's thought to be due to a release of prostaglandins and histamine. However, we can treat this by using Nsaids. Which anti-diabetic drug has an increased risk of hypoglycemia? Sulfonylureas. These drugs can cause the release of insulin by an increase in calcium influx. Sulfonylureas have first and second generations. So for the first generation sulfonylureas, such as chlorpropamide, they most commonly cause disulfiram-like reactions, while second generation sulfonylureas, such as glycol or glyphosate, cause hypoglycemia. What drug can be used to prevent vasospasms after a subarachnoid hemorrhage? Nimodipine. What is the treatment of choice of this condition? Praziquantel. What is the treatment of choice of a breastfeeding patient with Trichomonas vaginalis? Administer a single dose of oral metronidazole and discard breast milk for 24 hours after taking metronidazole. So this is because metronidazole enters the breast milk and can cause loose stools and candidiasis in exposed infants. And of course, we also need to treat the partner for trichomonas as well. Which beta-2 agonist is used for tocolysis? Terbutaline. Recall that we also have another tocolytic agent, which is indomethacin, which is an NSAID, and nifedipine, which is a calcium channel blocker. What is the typical empiric treatment for patients with human bite wounds? This question is very high yield for the USMLE Step 3, and the answer is amoxicillin clavulanate. What is the treatment of choice of subacute decurvain thyroiditis? and Nsaids beta blockers. So recall that subacute thyroiditis is a self-limited condition, and Nsaids are given for pain and beta blockers for thyrotoxic symptoms. Severe cases may also require steroids. A patient presents with recurrent UTIs for more than 3 months with transient improvement with antibiotics, as well as painful ejaculation. Urine culture shows bacteriuria. What is the diagnosis and treatment? So this patient most likely has chronic bacterial prostatitis, and this is treated with 6 weeks of fluoroquinolone and TMP-SMX. So this condition is typically due to E. coli going via the urethra to the prostate. Diagnosis of chronic bacterial prostatitis requires urinalysis before and after a prostatic massage showing urine leukocytes or bacteriuria. What is the treatment of choice of pyelonephritis in pregnant patients? You can use drugs such as cephalexin, fosfomycin, or amoxicillin clavulanate. So it's very important that you not use fluoroquinolones in pregnant patients. Do you remember why we should not use fluoroquinolones in pregnant patients? If you do, leave it in the comment section below. What is the treatment of choice of uncomplicated outpatient pyelonephritis and uncomplicated inpatient pyelonephritis? Oral fluoroquinolones such as ciprofloxacin or levofloxacin are used to treat uncomplicated outpatient pyelonephritis. However, for uncomplicated inpatient pyelonephritis, we use ceftriaxone. What prophylactic medication should be initiated in a patient who is beginning high-dose immunosuppression therapy following a renal transplant? TMP-SMX for PCP, ganciclovir or valganciclovir for CMV. What pharmaceutical treatment should be avoided in patients with MI that present with CHF, heart block, hypotension, or bradycardia? Beta blockers. What is the next best step in management of a patient diagnosed with spontaneous bacterial peritonitis? IV antibiotics and albumin. IV albumin is given to decrease the incidence of renal failure and to reduce mortality in patients with spontaneous bacterial peritonitis. The antibiotics given are usually third-generation cephalosporins. However, if you want to prevent SBP, you can give fluoroquinolones. So for SBP prophylaxis, think fluoroquinolones. For empiric antibiotics, think third-generation cephalosporins. Briefly go over some contraindications for antihypertensives. For gout, thiazides are contraindicated. If a patient has hypokalemia, you want to avoid the use of aldosterone receptor antagonists. If a patient has asthma, you want to avoid the use of beta blockers. For renal vascular hypertension, avoid ACE inhibitors or ARBs. Another high-yield fact is that antihypertensives can be used for the treatment of other conditions. For example, Raynaud's phenomenon can be used or treated with calcium channel blockers. And as previously discussed, nimodipine can be used to prevent vasospasms in patients with subarachnoid hemorrhages. So I'm sure that you can think of many other indications of antihypertensives aside from treating hypertension. What are the stimulant drugs used to treat ADHD? Methylphenidates, amphetamines. So how I remember it is that if the drugs have pH in it, then they are stimulants. But if they don't have pH in it, like clonidine, then they are non-stimulants. What is the treatment of choice of leptospirosis? Doxycycline. Recall that this medication is also used to treat Lyme disease if the patient is greater than 8 years old. If they are less than 8 years old, then we use amoxicillin. Doxycycline can also be used to treat Rocky Mountain spotted fever. What are the drugs of choice for endometritis? So this can be remembered with the mnemonic ECG. Endometritis is treated with clindamycin and gentamicin. ECG, clindamycin and gentamicin. Which antitussive is a coding analog and may cause serotonin syndrome? Dextromethorphan. What drugs can cause digitalis toxicity if they are used together? Amiodarone, verapamil, quinidine. So acute toxicity with digitalis can present with GI symptoms such as anorexia, nausea, vomiting, abdominal pain, while chronic symptoms present with neurological symptoms such as blindness, weakness, and scotomas. What diuretic can worsen or cause gout? Loop diuretics. What drug is a mucolytic and an antidote for acetaminophen overdose? N-acetylcysteine. What condition can present after 6 days of phenylephrine use? Rebound congestion. Recall that phenylephrine and pseudoephedrine are alpha agonists that are used as nasal decongestants. However, when you use these medications, it can result in hypertension and CNS stimulation and anxiety. What drugs can cause agranulocytosis? Well, you can remember this as AC. So antithyroid medications, clozapine, carbamazepine, chloramphenicol. So you can remember with this image right here of the 3 air conditioners. Also recall that chloramphenicol can cause gray baby syndrome. Which drugs can cause photosensitivity? Sulfonamides, amiodarone, and tetracyclines. You can remember this by saying, I sat for a photo. What is the first-line treatment for bulimia? Fluoxetine, which is a SSRI. What are 3 herbal supplements that can increase the risk of bleeding? Garlic, ginseng, and ginkgo biloba. Probably pronounced those incorrectly, but let's look at the spelling here on the screen. Which antidiabetic should be held before doing a CT with contrast. Metformin. Recall that metformin is a biguanide, and one of its very famous adverse side effects is that it can lead to lactic acidosis. So because of this risk of lactic acidosis in patients with metformin, the contrast can further potentiate this lactic acidosis, making it very dangerous for patients. So what is recommended is that metformin is withheld from the patient before doing an imaging test that requires contrast. Which drug can be used in the management of chronic myeloid leukemia? Imatinib. What is an antidote for this substance? Fresh frozen plasma, vitamin K. What is the drug of choice for leishmaniasis? Sodium stibogluconate or amphotericin B. Recall that this condition is transmitted by sandflies. What drugs can cause pulmonary fibrosis? Busulfan, bleomycin, amiodarone, methotrexate. I'm sure that you can list other drugs that cause pulmonary fibrosis. Please list them in the comment section below. What is the treatment of choice of pertussis? A macrolide. So this is also used for prophylaxis for close contacts as well. What drugs can cause drug-induced Parkinsonism? Dopamine receptor antagonists. And of course, metoclopramide has some dopamine blocking effects as well. And it's important to note that these drugs can also lead to neuroleptic malignant syndrome. What is first-line treatment for trigeminal neuralgia? Carbamazepine. It inhibits neuronal high-frequency firing by reducing the ability of sodium channels to recover from inactivation. So it's very important that I mention the mechanism of action here because this question is so common on exams and on the USMLE. So instead of just listing carbamazepine, they've started to list the mechanism of action of the drug instead. So just take a closer look at this and commit this to memory. What antihypertensive agents are safe to be used during pregnancy? Hydralazine, labetalol, alpha-methyl-dopa. And a lot of people remember this by saying hypertensive moms love nifedipine. Hypertensive for hydralazine, moms for methyl-dopa, love for labetalol, and N for nifedipine. Hypertensive moms love nifedipine. Very high yield to know this. What are signs of phenytoin toxicity? Nystagmus and gait unsteadiness. What anti-anginal agent is used to treat chronic exertional angina refractory to conventional medical therapy? Ranolazine. How do you manage someone with HIT or heparin-induced thrombocytopenia? Stop heparin, then administer direct thrombin inhibitor. What is the treatment of choice of pyelonephritis? Ceftriaxone. Which anti-diabetic drugs increase the risk of UTIs? The anti-diabetic drugs with flo in it. So dapagliflozin, empagliflozin. What is the first-line treatment for malignant hyperthermia? Dantrolene. This blocks the receptors and prevents the release of calcium into the cytoplasm of skeletal muscle fibers. What possible side effect can result from using statins and fibrates? For example, atorvastatin and gemcitabine. Well, this increases the risk of myopathy in patients being treated for hyperlipidemia. What is the drug of choice for mastitis? Nafcillin or dicloxoxilin. So mastitis is most commonly caused by Staph aureus. In patients with mastitis present with fever and unilateral breast tenderness. What is the treatment of choice for carcinoid syndrome? Octreotide. What is the treatment of choice for close contacts of meningitis patients? Rifampin or ceftriaxone or ciprofloxacin. So let's say that a patient has meningitis and they were in close contact with a patient that is pregnant. Which of these medications would be appropriate to give that pregnant patient? Leave it in the comment section below. Which anti-diabetic drugs can cause weight loss? GLP-1 agonists such as exenatide and DPP-4 inhibitors such as the gliptins. What is the treatment of choice for a UTI in a pregnant patient? Nitrofurantoin or phosphomycin. It's very valuable that you remember that you should not give drugs such as ciprofloxacin because they have teratogenic effects. So no fluoroquinolones for pregnant patients. How do you treat a patient that presents with clinical features of this condition? Basically, you want to take care of your ABCs. So you want to secure the airway, provide IV fluids, and the first line treatment is with atropine. However, if the patient is refractory to atropine or isn't seeing the clinical improvement, then you can go ahead and give glucagon. So for patients with this condition, they present with bradycardia, hypotension, wheezing, hypoglycemia, delirium, seizures, and cardiogenic shock. So typically, IV glucagon is second line if there is profound or refractory hypotension. What is the treatment of choice of otitis externa? Fluoroquinolones. What vaccine should patients who take eculizumab receive? These patients should be vaccinated against Neisseria. And basically, you need to remember that eculizumab is a monoclonal antibody against C5. So patients who take this medication or patients with terminal complement deficiency should receive their vaccine against meningitis, specifically for Neisseria, because the complement is needed to basically fight or combat this organism. What is the mechanism of action of vincristine? It inhibits polymerization of microtubules. Another high yield thing that examiners like to test is the adverse side effects of vincristine, and that is it can cause peripheral neuropathy. What is the treatment of choice of otitis media? Amoxicillin and clavulanic acid or cefuroxime. So recall that for otitis externa, it is treated with fluoroquinolones, while for otitis media, it is treated with amoxicillin and clavulanic acid or cefuroxime. This is very high yield, particularly for patients who are not patients, for applicants who are doing the USMLE Step 3, especially for day 1, you can be heavily tested on antibiotics. If you want to see a higher review on antibiotics, let me know in the comment section below. What class of drugs cause cartilage damage? Fluoroquinolones such as ciprofloxacin and levofloxacin. Administration of sodium nitroprusside can cause the accumulation of what element? Cyanide. So it's very important to look out for, excessive accumulation of cyanide presenting in patients because, for example, if a patient comes in and they have hypertensive emergency and you administer nitroprusside, you need to be aware of this adverse side effect. Another common cause of cyanide poisoning is a house fire, and these patients usually present with lactic acidosis, altered mental state, and cherry red macula. What vitamin can be used in the treatment of methylglobinemia? High dose ascorbic acid. So basically, to manage this condition, you need to discontinue any medication or drug that could be causing it. And also, you need to give methylene blue. However, it's high yield that you remember that methylene blue is contraindicated in cases such as G6PD deficiency. Basically, methylene blue acts to reduce methemoglobin to hemoglobin, and vitamin C is also a reducing agent. What is the first line treatment for toxoplasmosis? So to treat this condition, you would need to use these drugs listed here. What is a potential side effect or complication of using fibric acid derivatives and bile acid binding resins? They increase the risk of cholesterol gallstones. What is the best next step in a patient who is in anaphylactic shock and that is unresponsive to their first dose of epinephrine? Give another dose of epinephrine. What are early signs of toxicity with this drug? GI symptoms such as nausea and vomiting, lethargy, respiratory depression, and QT prolongation. What is the treatment of choice of histoplasmosis, blastomycosis, sporotrichosis, and coccidiomycosis? Itraconazole. Which antiretroviral causes vivid dreams? Efavirenz. What is the treatment of choice of entamoeba histolytica? Metronidazole. So recall that patients with entamoeba histolytica can present with bloody diarrhea and liver abscess. Is doxylamine more sedating than desloratadine? Yes. So recall that the second generation antihistamines are less sedating. So I remember these or this concept with the S's. So basically doxylamine is a first generation H1 blocker, while desloratadine is a second generation H1 blocker. So second generation H1 blockers are less sedating. So how examiners test this concept is, for example, you have an elderly patient and they need to be treated with antihistamine, and they will list drugs and they're all antihistamines. And you have to determine which one is less sedating. Because typically for elderly patients, you want to give them those less sedating drugs. What is the drug of choice for nightmares and PTSD? Prazosin. Prazosin is an alpha blocker that was initially used to treat hypertension, but now it's more commonly used to manage symptoms of BPH and nightmares associated with PTSD. To continue learning more high-yield concepts for the USMLE, just click this video right here.